Welcome back to Your Hour. Kathy Adkins joins us now. She's an RN and a dementia specialist. And, you mentioned earlier that there's always something new coming up in the research for dementia on treatments and cause and effect and all kinds of things.
All kinds of things that are out there. And being a fan of reading the Journal of Alzheimer's and Dementia every other month, which is very boring reading, but interesting, but it's boring. But I was able to speak with a person this weekend, unexpectedly, wasn't even on my radar, was at a trade show, and this gentleman was obviously a doctor of some kind, and he had an enormous blue tube inflated, and my curiosity got the better of me. And being all my years in critical care and ER and trauma, I thought I knew maybe what it was, and it was a hyperbaric oxygen chamber.
Ah, okay.
We used hyperbaric oxygen for years and years for divers, deep sea divers, when they come up too quick and got the bends, and got the wrong ratio of nitrogen and oxygen in their blood.
Do they use it for burns too?
We're using it for a lot of things.
Okay.
Wound healing, burns, basically. If you can tolerate being in an enclosed tube, if that doesn't bother you too much, and all it is the increasing the pressure of the oxygen in the atmosphere you're in, so it drives the oxygen into the cells. We're dependent as a Homo sapien of that oxygen being delivered to the tissue by our heart and our lungs and our blood vessels. Well,
Sure.
your blood vessels are compromised, or your skin or everything is compromised, like in burns or diabetes or wounds and so forth, then the oxygen can't be delivered to the site, whereas hyperbaric oxygenation forces it into the tissue
Okay.
from the outside and has no effect otherwise, outside of some people have severe claustrophobic tendencies and can't
That would probably be me.
take being enclosed in this tube. But I was talking to this doctor, and he looked at my name tag, and he said, "You know that we're using hyperbaric oxygen with dementia treatment." And I said, "First thing a good nurse is always going to say is, prove it. Where's the research?"
Yeah.
You can say all you want, but that doesn't necessarily mean I believe everything you say. But he said, we do have the research, and he said, I'd be happy to go over the research with you. So I'm making arrangements to meet with him and see how I can further use this in my clients and to be telling people about it and to promote it so that if there's a better way, and I'm trying to physiologically, when you tell a nurse something, a good nurse, they're going to take it apart scientifically and see if it all matches the books and how exactly does that work and how does it fit in. And if it doesn't fit in, then it's kind of, okay, that's nice to know, but
Yeah.
that's just about all it is, nice to know. So I'm getting arrangements to meet with him, and had confirmation that we do have a brain aging doctor in this town.
Really?
Not well known, not a big practice. He's somewhat shunned kind of by the normal medical society because this is an MD who also has a PhD.
Uh-huh.
And that doesn't intimidate the doctors, but the fact that he's trying to do something and has research that proves that he's reversing Parkinson's disease.
Oh, really?
That's a big deal.
Yeah.
And I visited with this doctor about a year ago. His wife does brain mapping for him, which is a whole nother issue that we could discuss. And I can't discuss it intelligently because it's beyond my level. But she helps institute what you need to do to make the changes in your brain,
Uh-huh.
which proves that the plasticity of the brain is such that we can make those changes. So there's things out there. Everybody wants the magic potion, lotion, or pill. It's still a combination of things, and you still have to actively try to make these changes. But I'd be happy to talk with people and to put them in touch with this physician. I will do a little bit of a screening first with them because I do not want him having a deluge of everybody with every problem possible in the world before I send him on to referral from him. But it's exciting to know there are things out there because, at our age, we have to stop and think, there but for the grace of God go I.
Exactly.
And when is that going to kick in with me? And,
Mm-hmm.
oh, I forgot I turned the oven on. Do I have dementia?
Yeah.
No, you have too many things going on in your life, and
Yeah.
you need to set timers so that you can handle them.
Yeah, I heard one time that multitasking is the art of screwing several things up at once.
Exactly, exactly. And another doctor said, as long as you can ask the question, you don't have the problem.
Yeah.
So it's when you don't know what the question is to begin with, maybe you need to think about getting a little help. But there's a lot of help out there, and I'd be happy to help people, and just give me a call.
Cool. Well, Kathy, it's always a pleasure having you here.
Thank you.
And we'll be back in just a couple minutes with Jeff Elston. He'll be joining us via Zoom, and he's going to be talking about America's Policy Institute. So don't go away.